If your legs often feel cold, heavy, tired, or strangely weak after only a short walk, you may be tempted to blame it on age. But here is the part many people miss. Sometimes the issue isn't simply getting older. Your circulation depends on healthy blood vessels, healthy blood cells, working muscles, and the nutrients your body uses to maintain all of them. And among the many vitamins sold for better circulation, only a few have a meaningful role in the systems your legs depend on. In this video, we're going to focus on 3, not 20. Not a cabinet full of supplements. 3 vitamins with important biological roles that are especially worth understanding as you get older. And the third one may be the most important to recognize because a deficiency can quietly affect your blood, nerves, muscles, and energy at the same time. I'm Dr. Emily Carter, and I want you to think about circulation differently, because healthy circulation isn't just about warm feet. It's about whether oxygen and nutrients can reach the muscles that carry you through your day. It's about walking to the mailbox without your legs giving out, climbing the stairs without stopping every few steps, getting out of a chair with confidence, and preserving the independence you've worked so hard to keep. Let's start with the first vitamin. Vitamin C. You probably associate vitamin C with oranges, immune health, or avoiding a cold. But your blood vessels need it too. Think of your arteries and veins as an enormous network of flexible roads carrying supplies throughout your body. Those roads have walls, and those walls depend partly on collagen, a structural protein that helps provide strength and integrity to connective tissues. Vitamin C is required for collagen production. That doesn't mean taking extra vitamin C will automatically open blocked arteries or dramatically increase blood flow. It doesn't. But it does mean that adequate vitamin C is part of maintaining normal connective tissue and blood vessel structure. And there's another reason this matters as you age. Your body is constantly repairing small amounts of wear and tear. Your skin does it. Your muscles do it. Your connective tissues do it. Your blood vessels do it too. Vitamin C participates in those maintenance processes. That is why I like to think of vitamin C as the maintenance vitamin. It doesn't act like a traffic officer suddenly clearing every road. Instead, it helps provide some of the basic materials your body's maintenance crews need, and you don't necessarily need a supplement to get it. Food can provide plenty. Bell peppers, oranges, grapefruit, strawberries, kiwi, broccoli, tomatoes, and other fruits and vegetables can contribute significant amounts. One medium orange, for example, provides roughly 70 milligrams of vitamin C. The recommended daily amount for adults is about 75 milligrams for women and 90 milligrams for men, with smokers needing an additional 35 milligrams per day. So you can see why a normal food-based diet can make a meaningful contribution. But here's where the story becomes more interesting. If your diet is already rich in fruits and vegetables, taking a huge dose of vitamin C isn't necessarily going to produce better circulation. More isn't automatically better. High supplemental amounts can cause digestive problems, and in some people they may increase the risk of kidney stones. So don't hear vitamin C matters and translate that into "I need megadoses." The real takeaway is much simpler. Make adequate vitamin C part of your normal diet rather than chasing enormous doses. And there is another reason I started with vitamin C. Because circulation isn't only about the blood vessels themselves. Your legs also need something else: oxygen. And that brings us to vitamin number 2. Vitamin B12. This one deserves much more attention than it usually gets. B12 is involved in making red blood cells and maintaining healthy nerve cells. And those two jobs matter enormously when you're talking about your legs. Imagine that your circulatory system is a delivery service. Your blood vessels are the roads. Your red blood cells are the delivery trucks. And oxygen is part of the cargo. You can have perfectly good roads, but if your delivery trucks aren't functioning properly, the system won't work the way you want it to. Vitamin B12 helps your body make healthy red blood cells. When B12 deficiency develops, it can contribute to a type of anemia, meaning your blood doesn't carry oxygen as effectively as it should. That can leave a person feeling unusually tired, weak, or short of breath. But B12 has another side. Your nervous system depends on it. And that becomes especially important when someone notices strange sensations in the feet or legs. Numbness, tingling, pins and needles, burning sensations, balance problems. These symptoms can have many causes, and I'm not saying B12 deficiency is responsible for yours. But B12 deficiency is one of the nutritional problems that healthcare professionals can evaluate. And this is where older adults need to be particularly thoughtful. B12 absorption can become more difficult with certain gastrointestinal conditions and with some medications. Long-term use of acid-suppressing medicines can interfere with B12 absorption in some people. Metformin, a medication commonly used for type 2 diabetes, can also reduce B12 levels over time. That doesn't mean you should stop either medication. Absolutely not. It means that if you're taking these medicines and have symptoms or risk factors for deficiency, B12 status may be something worth discussing with your healthcare professional. This is a perfect example of why simply buying a vitamin isn't always the answer. Sometimes the important question isn't, what supplement should I take? It's, do I actually have a deficiency? And there is another important warning. If you suddenly develop weakness or numbness on one side of your body, difficulty speaking, facial drooping, severe sudden dizziness, or other sudden neurological symptoms, don't assume it's a vitamin problem. Seek emergency medical attention. Serious circulation and neurological problems can sometimes look deceptively ordinary at first. Now, if B12 is the delivery support vitamin, there is one more vitamin that deserves our attention because it plays a very different role. Vitamin D. And this is where the story connects circulation with something many older adults care about even more: strong legs. Vitamin D is best known for its relationship with bones. But vitamin D receptors are also found in muscle tissue, and vitamin D is important for normal muscle function. That matters because circulation and mobility are closely connected. Your calf muscles aren't just there to move your ankle. When you walk, the muscles in your legs contract and relax repeatedly. That movement helps push venous blood back toward the heart. Think of your lower legs as having a built-in support system for blood return. When you're sitting for hours, that system is relatively quiet. When you walk, your muscles become active. Step after step. Contract, relax, contract, relax. That's one reason regular movement is so valuable for circulation. And vitamin D helps maintain normal muscle function. But here's the distinction I want you to remember. Vitamin D is not a magic circulation booster. If your vitamin D level is already adequate, taking extra vitamin D isn't guaranteed to make your legs stronger or your circulation dramatically better. The value is greatest when someone is deficient or insufficient and that problem is appropriately addressed. This is one of the biggest misunderstandings about vitamins. A nutrient can be essential without acting like a drug. Your body needs enough, not necessarily enormous amounts. And vitamin D is one vitamin where excessive supplementation can actually be harmful. Too much vitamin D can raise calcium levels in the blood and potentially cause serious problems, including kidney complications. So don't start taking large doses simply because you heard that vitamin D is good for your legs. A blood test and individualized medical advice can be much more useful than guessing. And now you can see something important. These 3 vitamins don't perform the same job. Vitamin C supports connective tissue maintenance. Vitamin B12 supports healthy blood cell formation and the nervous system. Vitamin D supports bone health and normal muscle function. They're different pieces of the same larger picture. But here's where many people make the mistake. They hear better circulation and immediately think about supplements. They forget about the system those supplements are supposed to support. Imagine trying to improve traffic by polishing the road signs while ignoring a major road closure. You wouldn't do that. And your body deserves the same kind of thinking. If your legs repeatedly hurt or become unusually tired when you walk and improve when you rest, that deserves medical attention. If one leg suddenly becomes swollen, painful, red, or warm, don't reach for a vitamin bottle. If your foot becomes suddenly cold, pale, blue, numb, or extremely painful, seek urgent medical care. Those symptoms can indicate circulation problems that require medical evaluation. And if your legs are gradually becoming weaker, your walking distance is shrinking, or you're struggling more with stairs than you used to, don't automatically write it off as aging. Sometimes the most important circulation vitamin is actually a conversation with your doctor. Because peripheral artery disease, diabetes, anemia, nerve problems, heart conditions, medication effects, and other issues can all affect how your legs feel. A vitamin cannot substitute for finding the cause. So what should you actually do? Start with food. Aim for a varied diet containing fruits, vegetables, protein-rich foods, and nutrient-dense whole foods. For vitamin C, think citrus, berries, peppers, broccoli, tomatoes, and other produce. For B12, think fish, meat, eggs, dairy, or fortified foods, depending on your diet. For vitamin D, sources include fatty fish, egg yolks, and fortified foods, while sunlight exposure can contribute to vitamin D production, depending on season, skin, age, location, and other factors. Then, look at your medications and health history. If you're taking metformin, acid-suppressing medications, or other long-term medicines, ask your clinician whether monitoring certain nutrients makes sense for you. And if you have persistent symptoms, don't self-diagnose. A healthcare professional may be able to determine whether your problem involves circulation, nerves, muscles, anemia, nutrient deficiency, or something else entirely. There is one final piece that ties everything together. Your legs don't live in isolation. You can have adequate vitamins and still have poor circulation if you spend most of the day sitting. You can eat perfectly and still have vascular disease. And you can take supplements while missing the most powerful everyday signal your legs need: movement. Even regular walking, when appropriate for your health, gives your muscles a reason to work. Your calves contract. Your heart keeps pumping. Your body responds to activity. That's why I don't want you to leave this video thinking the answer is hidden inside 3 bottles. The real lesson is bigger. Nutrition supplies the raw materials. Movement keeps the system active. Medical care identifies problems that nutrition alone cannot fix. And your daily habits determine how consistently all of these pieces work together. So remember the 3 vitamins this way. Vitamin C, the maintenance vitamin. It supports collagen production and normal connective tissue health. Vitamin B12, the blood and nerve vitamin. It supports healthy red blood cells and normal nervous system function. Vitamin D, the muscle support vitamin. It contributes to normal muscle and bone health, which matters greatly for mobility. But don't confuse essential with miraculous. The goal isn't to take the highest dose. The goal is to meet your body's needs safely. And if your legs are telling you something unusual, persistent pain with walking, unexplained weakness, numbness, swelling, color changes, or sudden severe symptoms, listen to them. Don't cover up the message with a supplement. Find out what the message means. Because healthy aging isn't about never having a health problem. It's about recognizing changes early, taking sensible action, and protecting the abilities that make life worth living. Being able to walk into the kitchen without thinking about every step. Standing up from your favorite chair. Taking a walk with your spouse. playing with your grandchildren, traveling, shopping, going outside, living your life without constantly wondering whether your legs will keep up. Those are not small things. They're freedom. And protecting that freedom begins with understanding your body, not fearing it. If you found this information useful, subscribe to Healthy Aging with Dr. Emily Carter for more evidence-based guidance designed to help you stay strong, mobile, and independent as you age.